if I stream on YouTube, your face won't be there though. It's just me doing the procedure. I've actually noticed that I've been getting a lot of subscribers. I was able to gain about 1,000 subscribers. So you just, you have to act normal. We can act normal. I'm gonna start in the back, all right? Your skin is like rubbery, different texture for sure. Does it hurt? What happened? Yeah, no problem. How we doing? Good. Give me 1 second. Okay. What was that noise? I was like, what the fuck? All right, I see you guys have questions here. I'm kind of focused on the hairline because the hairline's a little tedious. So, sorry about that. I wanna start from the first. Yeah, this is scalp micropigmentation. It's in other words a hair tattoo. We do use puntillism art to be able to create and replicate hair follicles. Um, it's gonna look like he had a haircut. Mainly more like broken hairline, something that's undetectable. This is an alopecia case where the client has actually an autoimmune disease that it's affecting his hair. So all this right here is pretty much hair loss that he definitely needs to get into a treatment, but it's not 100% guaranteed. So he decided to go with SMP because he's looking more for a um, a faster result, and an SMP is the best option. It's actually very secure because we're not treating it as a regular tattoo. This is actually SMP, is a procedure that is actually for hair loss, that a lot of doctors, dermatologists are actually using it in their clinics to promote it and to help them with hair transplants. So I would definitely recommend you doing a research. You can please feel free to subscribe to my YouTube channel. On there, we usually have our Instagram as well, so you guys can follow. It does would age well. Reason why is because our skin tend to be more transparent. So over time, since the procedure, the depth of this pigment is very superficial, it tends to fade away. So once that does, he just need to come back for touch-ups, and he definitely will age well. We've been doing this for over 15 years, and I've seen clients that had done like a long time ago, and they come back with getting touch-ups, and it looks amazing. It looks obviously looks a lot lighter than how they recently get it done, but with the touch-up, it definitely revives the whole procedure. Um, I've seen another question here about um, it can actually promote healthy hair growth because it actually stimulate the blood circulation. So in his case right here, it can actually trigger um, hair growth and in this case. Well, right now our client is under numbing, so he does not feel anything, and it does take quite a bit because we do have to blend into the size. There's a lot of hair loss on the sides as well, so we have to be very tedious and careful where we're gonna place these impressions and make sure that it looks as natural as possible. His texture is a little bit rubbery, so it's a little bit challenging. So that's why I was actually quiet the first on the hairline because I wanted to make sure that it looks at its best. And I also wanted to make sure that my client doesn't feel uncomfortable that I'm talking. Yeah, right now what I'm doing is basically blending it into his existing hair, creating that density, what we want. I already figure out kind of like the depth that I need to go, but it feels like I'm going a little bit deeper than the usual, a regular or a healthy scalp in a way. This is a scalp that's been because he has alopecia areata. The skin texture has changed dramatically, so it's definitely a challenge. But obviously, since we've been doing this for a long time, we know how to approach each case, and we'll be able to give him the best results. It might take an additional session, but it's okay because that's part of our warranty. We actually recommend you coming in and doing a consultation to be able to know what the warranty and guarantee results consist of. Yeah, the patches of hair that's due to the alopecia areata. So the moment that we actually decided to let the hair with this link because I wanted to know the hair pattern and that way I can kind of replicate it. But once we finish, we hopefully when he comes back for the second session, I might be able to cut it some. That way, because I want to know how his hair pattern grows, because I want to complement what he has right now. So hopefully we can see the how it heals, and then from there we'll be able to add more impressions and instead of adding in places that Once we cut it, we probably won't be able to see. I want to make sure that it complements with his natural hair growth, as in right now. This could change over a period of time because obviously with alopecia areata, like you never know how is it gonna, because a lot of times it can travel. Like we can start noticing hair growth, we can start noticing baldness. So it just depends on how it reacts according to the treatment and the medication that he's taking alongside with SMP that he's getting done right now. I definitely not recommend getting a wig because that's gonna actually affect the hair follicles and it's gonna affect the skin condition. So definitely, I don't recommend a wig because of the fact that nowadays they're saying that the adhesive that you use for gluing the unit is cancerous, so it could definitely cause a lot more issues. And it's something that's not part of you versus SMP. This is going to be a procedure that is going to be part of your body, and it's low maintenance as well. Obviously, it has its pros and cons like any other solution, but then that's when, whenever we do a consultation, we want to make sure that SMP is going to meet and exceed your expectations, and you also understand what the outcome is going to be. Because I'm not going to be here selling you a procedure if you don't want to cut your hair short, or if you don't feel like you need to conceal your scalp. If you want hair, you want treatments, like there are different solutions for you, but just depends on what type of or what area or what stage of hair loss you're in, because a lot of times people don't understand or might want hair but are not candidates to get a transplant, or neither are not candidates to do treatments. Um, Eventually, SMP is your last resource. I like to say this to a lot of people because of the fact that I would recommend you trying treatment first and see how it goes for at least a couple of months. And then from there, I would definitely recommend trying SMP if it doesn't work. And if you're not consistent with taking your medications daily or coming to your appointments to visit your doctor. So SMP is essentially the best and easy results for you to start noticing results right away. This right here is not specifically for hair growth, okay? So it's not gonna, it can help hair growth because it will trigger it, but it's not meant for hair growth. So that's one thing I want to disclose, and I want to let everybody know that it's not for hair growth. This is more cosmetic. It's correct. It is a hair tattoo. Pricing depends on each individual case. We tend to look into the amount of hair loss in the area, and from there we'll be able to determine how much is going to be your procedure. We do offer financing that it could be up to 24 months, 0% interest rate, depending on your credit. And I actually have a lot of my clients and patients that have taken advantage of the financing just because the monthly payments are pretty low and they don't get penalized or charged for any interest. So it's a no-brainer to take advantage of that. And on top of that, it's a soft pull, meaning that it's not gonna be a hard pull on your credit. So in case that like you pay it off within 6 months, it'll be actually a positive impact on your credit instead of a negative. We do have befores. It's actually on my phone, but this is the first session. So this session it's gonna pretty much be the foundation where we're gonna place our impressions, place our pigment ratio, and also we're going to see how everything heals due to the fact that he has rubbery scalp in a way. I'm pretty concerned that the retentions might not be as consistent as a normal skin. However, I am pretty confident that we're gonna have a really good turnout whenever he comes back for the second session. What if he turns gray when he gets older? So it goes along with the kind of the question I said about the skin. So the skin tends to the more we age, our skin tends to be a lot more transparent, and over time, the pigment would actually fade away. The pigment that we use, it's customized to the skin complexion. First session, we always like to go conservative, meaning that we always go lighter pigment, and then we go and we see how it heals, and then from there we'll go darker as we do the sessions. So once we finish the whole procedure, the SMP pigment should be looking just like a hair follicle. And then from there, what the SMP does is over time, the immune system tends to push it out, and then also the lifestyle of the client. If the client is very active, what's going to happen that the sweat glands is going to um, start, exposing sweat, and those pigments are going to fade over time. It's not going to happen overnight. It's going to happen over a slow period of time. The client won't even notice that the pigment has faded until you actually see a picture. Um, from when you first got it done versus the year of or the day of that he's looking at on his mirror or whenever he takes a picture. That's the only way that you would notice that your SMP has faded. A lot of people tends to be a lot more happy with waiting, 3 years before needing a touch up. Some people like to come back within a year or two because they like to keep it fresh. And whenever they come in, we look at the actual SMP, the actual skin, and we look at how everything healed. And a lot of times we have to go lighter on the pigment just because of the fact that, there's such things as gray hairs, there's such things as, the pigment retention and the pigment color has changed. So we have to go and complement what the client already has. That way we can make sure that it still looks intact and undetectable and natural. This is a very unique procedure. Like I said, it looks maybe from your eyes right now, what you're watching, it might seem to be pretty easy, just dots. But in reality, it does have a science behind it. It does have a skill. You have to have consistency on pressure. You have to have consistency on spacing, and also taking in consideration the actual hair follicles that the client has, and depending on the texture of the skin, because it is important to know that every texture is different. And also it's important for you to let the client know that in between the first and second session, it could be a change. And then from there, we'll take it, uh, we'll make adjustments and we'll pretty much create a game plan at that point if anything changes. However, for the most part, everybody seems to be, we seems to create a game plan from the first session, but there is small percentage of clients that we tend to change the game plan just because it could be from the client's perspective that maybe the hairline needed to be a little lower, maybe the hairline needed to be a little bit more sharper. That's just going to depend upon the client and upon the way how it heals on the second session. Every procedures that we do, we offer a warranty. We offer you know, we offer free laser removal in case that there's anything that we need to fix or adjust. At the end of the day, we want to make sure that everybody's happy with the results, and we want to make sure that we provide a consultation prior, and we want to make sure that you understand exactly what we're doing, because obviously it is a very tedious procedure that requires a lot of time and focus. So, yeah, so we do have a protocol. I know some of the clinics they actually do it virtually where they receive pictures and they get a quote right away. But in reality, a lot of people don't have the knowledge, don't have the time to research. And then when they come in, they might be thinking something different. They might be thinking that their expectations could be different than what you're thinking. A picture can say a lot, but if you don't know exactly what they're gonna expect, you might have a bad experience with your client, or you as a client is going to have a bad experience if you don't know exactly what you're getting. So I know that a lot of people nowadays they use chat gpt or they use AI, but you also have to be careful because a lot of information there could be a mistake. So I recommend you follow instructions, look at reputable companies, and make sure that you get your consultations, because that's what's going to help you the most, be able to ask as many questions as possible.